I'm Laura Reckford, and this is Sunday Journal. I'm here in the studio with Shine counselor Beth Fletcher. And Beth, welcome to the show.
Thank you very much.
Thanks so much for being here. We're talking about Shine and the program you have for people here on Cape Cod, but let's start with you explaining what Shine is. I know this is an acronym. It's serving the health insurance needs for elders, I believe.
Yes. And it's a program that is in every state. We are in Massachusetts and Florida. Its acronym is SHINE, but every other state it's called the SHIP program. So this is a program that is put out by the federal government to help people on Medicare.
And what is the history of the program? When did it start, and what's the purpose of it?
Well, it started, I think, back in 1985, and it was to help people understand their Medicare needs, because in the late 1980s, the beneficiaries had to send in their the doctor's reports and bills into Medicare to get reimbursed after they got paid. And so many of them didn't do it, or they sent it in wrong. They didn't fill out the application. I mean, it was just a hodgepodge, basically. This is how I got interested in it, because my folks were Medicare age, and I thought, well, I can certainly help them with this. It's not that big a deal. And sure enough, I mean, it was just confusing. And from there, it's just gotten better. And then in 1990, the government made the doctors send in to Medicare so that at least beneficiaries didn't have to pay up front and pay out of their pocket first and then try to get reimbursed.
There is probably no more complicated problem for people than dealing with health insurance and the government forms and the enrollment forms. And I know very intelligent people who simply cannot negotiate their way around this. Absolutely.
It's not easy. And even all of us, because there are 50 volunteers on the Cape, they're all situated at all the COAs. And even all of us learning it, I mean, we have to take a 12-day course to get even beginning to understand what we're doing. And it's still confusing.
I find it very interesting that you got involved in helping your parents, because I know this can be a very stressful process for seniors to figure out these forms.
Absolutely. And my folks felt that they were doing well by not sending it into Medicare. Well, we can afford this, and we'll pay for it. Well, they had put their money into the system, and they should have been getting it back. And finally, once those laws changed, the doctors sent it in, and that's so they ended up having Medicare pay them, and reimburse them.
I see. And just to clarify, who is eligible for this? Is it just senior citizens?
Basically, for Medicare, once you turn 65, that's your insurance. Also, anybody that might be on SSDI after a certain period of time, 2 years, they go on to Medicare. There are other instances of being eligible for Medicare, but it's basically 65.
And people's health insurance needs, of course, can change over time. So even if someone is signed up at first, they actually may need to rethink what program they're in.
Correct. When you're initially eligible at age 65, you need to sign up for Part A and Part B, because Part B has a penalty if you don't sign up right away. Because Part B costs. Part A is free. And that's true with Part D, which we're in. That's the open enrollment right now for the Part D program, which is your prescriptions. And you need to sign up for these things within the initial time so that you don't have penalties.
Now, we're already starting to get into some confusing things here, Part A, Part B, Part D. Maybe you can lay out a little bit of what we're talking about here for people who aren't in the system yet but will be in it soon.
Well, Part A and B are the original Medicare. It's what we've been around for years. And Part A basically is hospital, skilled nursing, and a few other things. And that is free when you turn 65. Part B is all the medical stuff, the doctor's visits, the labs, the outpatient surgery, the outpatient surgery. Sorry if I said that twice. And that cost, and this year it's $104.90 a month. And what's added on is now they've added in the prescription coverage, and that is a whole bunch of, there's 23 companies, I think, that are selling in Massachusetts this year. And all of them, I think the cheapest is $18.40. Some of them are $122, and it just varies depending on which one you pick.
Now, as a Shine counselor and someone comes in, you've got 23 different companies, and I think probably the prescription choices are maybe among the most important choices that people are
Sure
making.
is.
How do you walk them through that?
Well, happily, you go to Medicare.gov, and you go down and you look for your Part D, and you follow through until it asks you to start filling in. It really is easy. You fill in your medications, type them in, do all that it says, how often you take it and so forth. And at the end of that time, you then plug in your pharmacy, where you go to the pharmacy and you try to put in a couple so that you can see the change in prices. And then what it does, it just brings up the cheapest, the least expensive one for your medications this year. And that will be your top choice, and you have many others following it. And for all that sounds confusing, it really makes it easy for you, because you can go by what medications you need, not necessarily kind of a brand name company that's selling drug insurance.
In this case, computers have come to the rescue, it sounds like.
Yes,
but
absolutely.
The main thing about Shine, it seems to me, is if people aren't used to using computers or aren't comfortable, here's a human being who can really walk them through the process.
Absolutely. And with his counselors at all the COAs, both on the Cape and the islands, Martha's Vineyard and Nantucket. So there's plenty of us out there. As I said, I think she has 50 or 60 counselors.
And so I want to get into that quite a bit. The COAs, for people who don't know, the Council on Aging, or in some towns it's called the Senior Center.
Right.
And so the way you set up an appointment, do you just call your local senior center? Are the appointments only certain days, certain times?
For instance, I happen to volunteer in Chatham, and there are 2 days that are open for people to call, get an appointment. There's a Tuesday and Thursday, and we're there. I'm there one day, and the other counselor, Ira, is there on Thursdays, and we're there all day.
So people can call up their local senior center. It's probably different for each senior center or council on aging on the Cape in terms of what days and times they do it. And typically, if someone comes in and makes an appointment, how long does this process take?
Most of the appointments that are set up are about 45 minutes, at least in Chatham. That's how it works.
Takes about 45 minutes. And then I wonder if there are ways that people can prepare before having a session with a counselor.
If they can either bring a written list of their medications, or bring their medications, it just makes it easier, because you need to type in the exact name of the medication that they're on.
I'm Laura Reckford, and this is Sunday Journal. I'm here in the studio with Beth Fletcher, who is a counselor for the Shine program. One of the most important aspects of this, which I'm not sure if we've said it, this is a free service. Absolutely free.
And I do want to say that if, for instance, someone calls their COA and they're not going to be able to see a counselor, because this is a very busy time right now for counselors, and they can't see a counselor for 2 or 3 weeks, and they're feeling really pressured about the whole thing, you can call the main number for Shine here on the Cape, which is 508-375-6762, and speak. There's Sheila Curtis is the regional director for Cape Cod and the islands. She's there, and if she's not there, there is somebody there that could help you.
And that's a great resource, as you say. If you can't get an appointment, because a lot of people are trying to make appointments, you call that number and they can set up an appointment for you at someplace nearby.
Yep, or they could help you over the phone.
Oh, that's terrific. And give us an example, Beth, of how you've saved people money when you've been working with people.
Well, for instance, I went out to supper with my friend last night, and we were talking about the prescription. And she's one of the lucky ones. She takes no prescriptions. And basically, I'm going to end up saving her $300, because she was paying something like $55 a month for something that she doesn't need, but you have to do it, otherwise you get a penalty. And she's going to drop down to $18.40 a month. And you know, on these Part D companies, it doesn't matter the company name. There's a lot of names that people know, like AARP, Blue Cross Blue Shield, Tufts, Fallon, Humana, all these different names. All these companies change. They almost change daily, but they change the way they charge for their drugs. So you need to come in every year, and it's not wrong to change from these companies. I mean, a lot of the beneficiaries come in and say, well, they've been so wonderful to me. And that's great, but they all are wonderful. And I think it's wrong that to lose $300-400 a year just to stay with a brand name drug company.
And that's what's great about having a counselor there like yourself. You can walk them through again and see if they could save money by making a change.
Yes.
Some people, I would think I might fall into this category. You don't want to bother making the change because that's going to be complicated. So you'll just stay and you're not sure if it's costing you money or not. But people should check in.
Absolutely, because we can enroll them right there. I did that for several people the other day. Just enrolled them in the new one, and it's automatic. They get enrolled in one, it unenrolls in the other. So as of January 1st, things will change for them.
Now, when people come in for a session, and you said it's about 45 minutes, do you typically resolve everything in one session, or do they need to come back?
Okay, for instance, a couple came in, and they were concerned about their drugs, as they all are at this point, and they put down their cards. We always like to see them, make sure they're on Medicare and they've got a supplement plus the drug coverage. And I realized they were retirees from a big company. Retiree insurance is different than just having it buying it on your own. So for them, what's going to happen is they want to change out of their insurance that they have part of their pension. And I said, the number one thing you have to look for is, will this affect your pension that's going to be coming into your pocket every month? So they will probably be back. But most people, we generally get it done pretty much in 45 minutes.
And what about the deadlines for signing up? What do people need to know about deadlines?
Well, it goes through December 7th. It started October 15th, and this happens every year. This is the open enrollment time for your Part D.
And so people really need to get on this in the next
Yes.
month and a half or so. There isn't that much time.
No.
And so I can see how the Shine counselors would get their appointments booked up. Now, what do you find are the greatest misconceptions about health insurance, Medicaid and Medicare, and how people think that that's going to work for them?
I think they don't understand that Medicare pretty much covers 80% of everything that is done to them. And they only need a supplement. If you're fairly healthy, you can exist on Medicare if you have enough money to cover some of these small copays. You can exist on Medicare. That's really a super coverage. You add in the supplements that we have here in Massachusetts, and Massachusetts is a great place to be for Medicare insurance and supplements. Many years ago, the state said, if you're selling a Medicare supplement in Massachusetts, these three different types, they had a very low type, they had a medium type, and one that included prescriptions. They have to be the same. Doesn't matter which insurance company sells it, has to be the same. So that year we ended up with 2 insurance companies in Massachusetts, Blue Cross and maybe Harvard Pilgrim. I've forgotten that. But now we have a lot of insurance companies. But again, you can do it by price alone. And for the supplements, you can look at it and say, okay, this one is the cheapest, and it's the same as this one. It's a brand name, one that it's $60 more per month. So again, in Massachusetts, it is easy.
And you were telling us before the show, and I thought this was remarkable, that people really can save some serious money. You were working with the couple, you sat down with the couple and ended up saving them $700 not too long ago.
Yes. Again, it was kind of the same situation as my friend. The man did not take any medication at all. He was paying. They came in because his cost was going up to $55 a month. Hers stayed pretty much the same, but it could drop down. And I think for him, I was saving him $400, and for her, I think it was $300.
So some serious money when you add it all up.
For a year. That's for a year. I mean, that's money I want in my pocket.
Absolutely. And I want to, in the last couple of minutes, re-emphasize the phone number people can call in order to make an appointment. As you said, people can contact their local councils on aging or senior centers, depending on the town you live in. On the Cape, it could be one or the other of those. You find out that phone number, you call them up, find out when the appointments are. But if you can't get an appointment and you're in a hurry because this open enrollment period is limited, what number can people call?
It is the major number, which is 508-375-6762. And that goes to the main office.
And just to emphasize that this is about SHINE, the program SHINE, and this is a free service.
Yep.
And as you said, Beth, you've been doing it for quite a number of years.
Yes. I started out helping my parents back in the 1980s.
And now it's all these years later, and
Yes.
I'm sure in the last 30 seconds or so, I'm sure you've learned a lot over the years.
Yes. Yes.
And you're probably considered a bit of an expert on the subject at this point.
I don't know about that, but I enjoy it very much.
What would you say is the biggest thing you've learned over the years?
How wonderful people are. They come in and they're just concerned, and they're smart enough to come in and find out from people that know what they're talking about.
That's a great way to wrap it up. And unfortunately, we're out of time. I've been talking to Beth Fletcher, who is a counselor for the SHINE program. We've been talking about how people can find out about this very important free program that helps people with their insurance. Beth, thank you so much for being with me here today.
Well, thanks for bringing this to the front. It's great.
I'm Laura Reckford, and this is Sunday Journal.